Dana, and Assalamu alaikum, good morning, good afternoon, welcome all, distinguished colleagues, team partners, and friends. I'm Dr. Haytham Bashir, the Director of Public Health Emergency Management Center here at EMPHNET, and I'm very and honored to facilitate and moderate this session today, simply because this is one of the uh, closest topics to my heart. Personally, I do like and bias towards FETP. So, as I said, it is my pleasure to welcome you all to this World Field Epidemiology Day Symposium, a celebration of dedication, impact, and resilience of field epidemiology training programs across our region and globally. Today, as we come together virtually, we recognize not only the milestones achieved by our programs, but also the extraordinary commitment of field epidemiologists who stand on the front lines, investigating outbreaks, guiding response, and protecting communities in times of crisis. Over the years, FETPs have grown into a global movement, strengthening national and regional capacities to detect, respond, and adapt to public health threats. In our region, this journey has been marked by collaboration, innovation, and unwavering belief in the power of science-driven actions. At EMPHNET, we are proud to have been the driving power, a partner, facilitator, and advocates for FETP programs in our region. Through training, mentorship, operational support, and regional networking, we have worked hand in hand with ministries of health and global partners to ensure that our field epidemiologists are not just trained, but also empowered to lead. Today we are going to listen to our distinguished uh, speakers, the leaders of the FETPs in their respective countries in this region, but also we are going to listen to real uh, scenarios and success stories from our FETP residents, graduates, and mentors. As we celebrate, we also acknowledge our journey is far from over. Emerging diseases, humanitarian crises in our region, and the growing complexity of health emergencies demand that we continue to build stronger, more connected, and more sustainable FETPs. I will not take much of your time as we have too many speakers actually, which is a blessing. But I would like first to introduce a really special person who doesn't only believe in the FETP, but also he has been the supporter, the advocator, and an actual leader that has a vision to expand the FETP in our region and to create such a wonderful network in this region and beyond, as his role of leading EMPHNET, as well as leading other international initiatives related directly or indirectly with FETP. It is my pleasure to introduce Dr. Mohammed Mansour, the Executive Director of the Eastern Mediterranean Public Health Network and the father of FETP in this region. Dr. Mohammed, the floor is yours.
Thank you very much. And really, I am very delighted to be part of this sessions, and it means a lot to me. And maybe I cannot say frankly, as Haytham said, my colleague Haytham said, he is biased, although maybe I am biased also, but you know, because we are working at the organization. But let me, I have, you know, written speech, but I like, you know, to go beyond this and to tell you, you know, how the journey starts and how the FETP within my 5 or 7 minutes, you know, how we could together, you know, reach to what we reached today. You know, I remember early, you know, maybe in the first program in the region was established. It was the Saudi Arabia program, and it was established in 1998, followed by Egypt FETP, 1993, and then Jordan came 1998. So maybe I did a mistake. Maybe KSA or Saudi Arabia, it was 1980, 88 or 89. And then, it's followed by Pakistan. As I remember, I lived there and I was very close to this, one of the closest, maybe if FETPs to my heart, as others, Pakistan, in 2001. And the original idea is, to support, these programs and how we can provide some logistic support and how we can make sustainability of these programs. But the region, and the ministers of health were very ambitious. And it's really the region and the countries, took us to create more FETBs according to the country needs. So after establishment of EMPHNET in 2009, we thought that we felt, internally that we are committed not just only to focusing on these very respectful programs, but what about other countries? And here, we could, bring additional block to this experience. Then we start working in Iraq, Yemen, and etc. I am afraid to list all the countries. I will forget something, but it's growing, and all the countries realize the importance of the FETPs. And by coming of joint evaluation external mission, it was one of the requirements. So the countries start seeing more and more the importance of the FETP. In addition to all the technicalities, I see many experts here today, and I am sure they will cover whole technical and scientific aspects. So I am trying to cover other part of maybe the picture, which is, the FETBs, it's not only about science. It's not only about knowledge. Yes, it's very important, and this is the objective number one. But for me, as FETB graduate, FETB director, FETB resident, it was first exposure to me to the world. And, during my residency, I remember, I went, there was a part of what we are doing, to be deployed to another country. So I was deployed in Yemen, I was deployed in Pakistan. So this, take me or took me, to the reality and took me to build my capacity. And here again, technical capacity is very important, but also, to build my personality and to build my, trust and confidence of myself. First time I stand on behalf of all uh, to tell a presentation, after after, in the international community or conferences, it was due to the FETBs. So the FETBs goes really to the technical part, which is very important, and also to the personality type that we are nowadays we are leaders. Why? All of you are leaders. Why? Because you already being being seen or maybe exposed to the real field and real etc. I have studied master degree in a very good university, and once my teacher told me that you see, you are good here, you are doing good, but your knowledge with FETP is much more important than the science work. I am not saying this today, but I am saying that both of them are very important. When you are living in the field, when you are being close to the community, when you see the real real world, it means a lot. You learned a lot at the personal, technical, and other aspects, even, from ethical, moral, and to understand other people, other nations, other requirements. So, and this is the journey, we started this journey, and of course, without country, nothing will be happen without the country blessing, the country support. And of course, we also appreciate our partner supports. But in this way, nowadays, we are moving forward. We reached a point, just for history, maybe we need to write this as a history. Uh, uh, we need this, we start thinking why we are doing all the time the 2 years. Do we need this modality for the whole countries, 2 years? This is the classical way or the central way, or we can propose countries 1 year according to their needs or according to the target audience that we want to train. So I think the Eastern Mediterranean region was one of the pioneer regions where we start talking about FETP for 1 year. And this was very highly accepted in in Tunisia, in Lebanon, in Afghanistan, and other countries started like Sudan, big country, they need more different modalities. So we brought this another block, another block of change that we sometimes need to think more what the region needs rather than what we were given or what we have. We need to customize, localize, regionalize all our aspects. The other things, Ebola came, as you remember, and there was a quick programs. They call it uh, frontline training. And when we look, we try to bring this experience to our region. We found the health system in our region, Eastern Mediterranean region and beyond. I am talking always Eastern Mediterranean region and beyond, like we are working and respect Bangladesh and other countries that we are working with, Somalia, Djibouti now. So different countries, but also bringing, the front line, it has to be revisited and to meet with the health systems and to meet the surveillance and to meet the outbreak investigation. So we did radical changes on the programs, and we did not accept it as it is because it was not fit to the needs. So what happened in Guinea during that, it will not have fit to Egypt, for example. It will not fit to Morocco. So we have to revisit and restructure and rebuild the programs. And so on, many of these things that we are believing. I don't know. I don't want to take more time. Please stop me whenever you want. But this is my lovely, and this is as I see Mir Islam, my friend Mir Islam wrote, it's our birthday. So we have to make sure that we stop whenever the boss is saying we have to stop. So if you remember, colleagues, we were taught case studies, examples from USA that does not match with our region. And I am not criticizing this. They are excellent case studies. But we need also our case studies. So colleagues from the region, Dr. Haytham, Dr. Yusuf, of course, and other, technical experts, we are very proud today that we are the only region that we have case studies from our life, from our I was teaching surveillance, as I remember, in one country, and it was about strawberry outbreak. And I spent 3 hours talking about strawberry outbreak, if you remember this case study from USA. And by the end of the session, one colleague, trainees, residents, whatever you would like to talk, he told me, what you mean by strawberry? What is the strawberry? So I realized that we are working in not the right direction. We need to revisit this. So we start, building our case studies. And again, we saw that a lot of contribution from FETP programs in strengthening the health systems in their countries, but this is not scientifically recorded. And always they know it's underestimated. So nowadays, Eastern Mediterranean region and the countries mainly and beyond maybe, it's the number one of the number of the publication about FETPs and the role of FETPs in supporting the health system. All these efforts without you, colleagues believed on FETP. And the example that, the wonderful example that I will like always to end with, if we remember, and we all remember, it's not conditional, we remember, COVID-19, where the deployment and the external assistance was zero, and nobody can came from outside the country except, the country, the FETBs, they were the frontliners, and they were, sorry, very supportive to their countries. So the beauty of FETBs that they are to their countries belong first, and they are part of their countries, and they do not belong to anything else. So that's why, this is the power and the beauty of FETBs, that we are contributing in helping the ministries of health in building their health capacity. Thank you very much. Thank you.
Thank you. Thank you, Dr. Muhammad. And I think you said what we all wanted to say. And as you mentioned, while we are going through our agenda, we will be listening to more reflections and ideas. Next, allow me to present someone who, since he actually joined EMPHNET, has made significant um, additions to our FETPs in the region, whether the modality of the FETP trainings, or the aspect of documentation and research linked to FETP, the sources like, for example, e-library, development of case studies, structured evaluations for our FETPs at all tiers in the program in the region, accreditation, and many more. So I think our FETPs in the region lucky to have someone like Professor Yusuf who is leading the Center of Excellence for Applied Epidemiology, and would like all to listen for like for the next 10 minutes from Dr. Yusuf. Dr. Yusuf, floor is yours.
Thank you. Thank you, Dr. Haytham. Dana, would you please share the screen? Or you want me to share it from my side?
Ammar, you have Dr. Yusuf's presentation.
Hello, everyone. It's really great pleasure meeting you in this special day. Happy birthday and happy Field Epidemiology Day. I'd like in short, brief presentation, I'll highlight the support that EMPHNET provide to FETPs. Next slide, please. As you are fully aware that EMPHNET works with you for you to support your country programs and health system. EMPHNET invests all resources to support and strengthen the existing FETPs in the countries, and also working hard to establish new FETPs in other countries. The year 2025 will witness two new programs in Palestine and in Syria, the two countries that are in big need for such program. EMPHNET works to support FETP sustainability, institutionalization, and visibility. EMPHNET to provide support and opportunities for knowledge exchange and networking, and provide plenty of scholarships and trainings in different areas related to surveillance, outbreak investigation, infection control, and public health emergency, and others. Next slide. It's really a 15 years journey of network growth, a journey of achievements and impacts. When EMPHNET was established in 2010, 4 programs existed. Now, FETP is running very active programs in almost 13 or 14 countries. Next. We make sure that we publish and make your achievement visible by publishing FETP updates and disseminating this using all available channels through social media, FETP newsletters, and website. Visit our website. It has a rich material about your progress and about your achievements. Next. In the last years, we contributed to FETP science, not only practice. So we worked with residents and graduates, program directors to conduct and support research in the area of FETP, an area that is really neglected in our region. You rarely find research related to surveillance system, outbreak investigation. We make this a reality in high-ranked journals. In the last few years, FET Infinite supported you to publish more than 150 research papers. As Dr. Mohanad said, over 70 case studies were developed and published, developed by you and supported you technically to make these case studies available. Now they are using not only by FETP programs, many universities, many schools of public health are requesting these case studies to enrich public health learning. We supported over 20 mini-grant research projects in the last 3 years. We launched the EMPHNET Electronic Library, an amazing source for FETP resources, publications, and materials. And also, we always invite you to publish and to collaborate with other partners. Next, please. We have many platforms for knowledge exchange. Our web series, Infinite Web series, never interrupted after COVID-19. Almost we have 45 webinars conducted to date. The FETP Ambassador Program, 17 ambassadors are on board supporting your activities and the region activities. We are really proud about, our regional conferences, 8 conferences for now. Our next conference is scheduled for the next year. FETP Exchange Program is an amazing story in FETP. Currently, we are witnessing missions between Egypt and Iraq. People visiting from programs to learn more and contribute to other programs. Next. We did it for you. We established IAF, International Academy of Public Health, because we at Infinite, we believe in specialized disciplines of public health, not only providing support in FETP, but also we are building capacity in different areas, unique areas in public health, like health informatics, antimicrobial resistance, health economics, and we offer this through training courses, diplomas from 3 months to 6 months to executive masters in collaboration with distinguished universities in the region. Next. This is the final thought. Infinite remains committed to supporting FETPs in the EMR and other priority countries. Thank you so much.
Thank you, Dr. Yusuf, for the comprehensive, informative presentation, and thank you for giving us 1 minute of your plan time. So I think we have been through this journey together. I mean, all our countries, and I'm sure our colleagues will share their ideas as well. One of the speakers today, Dr. Taj Malouk, the program director from Afghanistan, and I remember when we first met here in Amman, I think 2017 or 18, and we were planning for establishing Afghanistan FETP. Actually, many believed at that time Afghanistan cannot run such a complicated program. However, EMPHNET has been still believes in Afghanistan capacity, and those years prove that we were right. And Afghanistan program now is one of the best programs in aspect of resilience. And but I will invite Dr. Taj Maluk to talk about their program, not me. Professor Taj Muluk, the floor is yours.
Bismillah ar-Rahman ar-Rahim. Good afternoon, everyone. From my side, I am pleased to celebrate World Field Epidemiology Day with all together. Congratulations this day to all. Beside it, I am grateful to EMPHNET leadership for its ongoing support for sustainability of Afghanistan Field Epidemiology Training Program. Then I will come to our achievements that we have done in the few years. A glance into Afghanistan FETP program overview. Next, a glance into the program. In 2009, with support of CDC, two health professionals from Afghanistan National Public Health Institutes were introduced to Pakistan FETP, who successfully graduated in 2011. Later in 2014, CDC collaborated with Afghanistan and Tajikistan Ministry of Health and established a regional FETP for both countries based on Dushanbe. In late 2016, the Afghanistan Public Health Institute Global Health Development in Eastern Mediterranean Public Health Network signed an MOU to resume the Afghanistan-owned FETP intermediate as a one-year program. In 2024, the program funded the frontline tier of FETP under the name of Public Health Empowerment Program for polio and API officers with adaptations and content and durations. Next. There are two programs in my country. One was the intermediate FETP program. Unfortunately, right now, we don't have so far these programs. Established in 2016, number of cohorts 5, number of graduates 125, group projects 20, individual projects 125, outbreak investigations outcome plus 100, strengthening of the technical capacity of the health staff. In frontline are PPO established 2024, number of cohorts 2, number of graduates 29 from 30s, field assignment 8, individual projects 125, outbreak investigations 100 plus, outcomes strengthening of the technical capacity. Next. Main activities, PACs, FETP exchange program between Afghanistan FETP and Pakistan FELTP, support of the health system through building the technical capacity of staff at national and provincial levels. FETP steering committee oversee the program. FETP SOPIA standard operating procedures developed and approved, intermediate FETP accreditations process, supervisions of field activities in assignments, progress on sustainability and nationalizations of the program. Next. Key achievements between 2021 and 2025. 33 EPTP residents and graduates in Afghanistan investigated more than 2,500 outbreaks across 25 provinces of the 34 provinces. During post-workshop of third and four cohorts, the concept of residence rotations program was implemented. Development of EPTP, standard operating procedures, and oversee of the program by the steering committee. 20 plus group projects with primary data collection in 30 plus provinces and 125 individuals projects with secondary data. Publication of several manuscripts in national and international journals. Introduction to the health management and principles of epidemiology in public health practice book. 50 plus scientific abstracts presented in national and international conferences. Completion of 5 intermediate cohorts with 125 graduates and 1 PEP cohort with 29 graduates. Initiations of the intermediate EPTP accreditation process for 2025. Next. Thank you very much for your listening.
Thank you. What amazing achievements in such short period of time. And still in the eastern part of the region, and I mean Mohammed, because we consider Bangladesh as one original member of this FETP family here. So Bangladesh brought to us new experiences, especially when it comes to, yes.
Yeah.
Professor Tahmina, yes, are you ready?
Yeah.
Please,
yeah, thank you.
on.
Yeah, can you hear me, Dr. Haitham?
Yes, yes,
So,
yes.
Good morning, good evening, and good afternoon. Okay, this is Professor Tahmina Shireen from Bangladesh. First of all, I would like to congratulate EMPHNET for their 15 years of journey, and also wish successful journey ahead. So I think okay. So now can you see the slide?
Yes, we can. Yes.
Okay. So can actually, I'm on the road. I am on the street. That's why I'm on the way to my home. That's why sometimes it's remain disconnected. Okay. Now, actually, Bangladesh started the FETP program in the country since 2013 with the starting of FETP Advanced. Later on, we subsequently we have started first the frontline FETP, and then in 2022 FETP Intermediate with the support from the full from EMPHNET
Professor Tahmina, I'm afraid that the voice is interrupted. We can't hear you clearly.
we could start this, then we converted into 12 months of, and right at, I mean, as we have started.
Okay, I think we find it really difficult to follow your presentation. Do you mind, Professor Tahmina, to go down to the agenda once you are reach your destination? Yes, Professor? Okay. Unfortunately, I think we lost Tamina, but we will see how our agenda will go as we go. So next, again, an example, actually successful example of how FETP is linked to service provision and improving the health indicators among population. My pleasure to introduce Dr. Hala Bahauddin, the Director of Egypt FETP. Dr. Hala, you are welcome.
Thank you, Dr. Haytham. Good afternoon, everybody, and happy World Epidemiology Day. Can you see my screen?
Yes, and yes, now we can see. Please.
Yes, it's my pleasure to share the Egypt FETP story of strategic expansion, excellence, and innovation. Egypt FETP was established in 1993 in collaboration with the US CDC. To date, the program successfully trained over 400 public health professionals. Our graduates include 174 from advanced FETP, 2002 from basic FETP, and 35 from intermediate FETP. We are expanding our geographic reach, moving beyond the central level to host skilled residents in all governorate across Egypt. We trained both medical and paramedical professionals, recognizing that health security require a whole team effort. Egypt FETP graduate hold a key leadership position at the Ministry of Health at Central Directorate and district levels, and also leading the international organizations such as EMPHNET, Africa CDC, WHO, and more. They are shaping public health policy and response at national, regional, and global levels. In 2022, we achieved definite accreditation. This recognition places us among a global network of programs meeting the highest standard of training. We are moved beyond traditional public health surveillance and are now building multi-sectoral expertise. Our residents now represent different fields such as public health laboratories, climate change, water and food safety, AMR, animal health, and more. The diversity is our strength, equipping us address public health threats from every angle. We serve as the execution arm from the Ministry of Health Priority field activities, leading the rapid response teams during the outbreaks and data collection efforts of the priority epidemiological studies and health surveys. This collaboration ensures data-driven decision-making, which is essential to building a healthier Egypt for all. Over the past 10 years, we have published more than 100 articles in high-impact journals, and we are internationally recognized with a strong presence on the regional and international stage. Over the past 5 years, our residents have present more than 100 abstracts at the regional and international conferences. We are building partnership with governmental and international organizations across human, animal, and environmental health sectors. This expanded network allows us to pioneer innovative multi-sector programs. We are proud to have hosted the region's first basic level 1 health FETP cohort in 2024, and now we are preparing to launch the intermediate level by next month, inshallah. We are also working now with the basic level of FETP specialized track on vector control, and we will celebrate the graduation of this cohort by the end of this year, inshallah. Our expansion extends beyond our borders. Our successful collaboration with EMPHNET recently on a regional exchange program has made Egypt a hub for sharing knowledge and field experience. This is the Egypt FETP today, accredited in quality, expanding in scope, and essential for nation's security. Thank you, and happy World Field Epidemiology Day.
Thank you, Dr. Hala. Very impressive expansion and added value for Egypt FETP. As you may notice, I'm going through our countries in alphabetical order for those who didn't notice. So expected next is our friend Dr. Yasser Majid, Director of Iraq FETP, and I think Iraq has much to share, especially when it comes to the issue of accreditation, being the only country in the world that got the 3 level of accreditation. So, Dr. Yasser, the floor is yours.
Thank you, Dr. Haytham. Good morning, good afternoon, everybody. And as Dr. said, happy Epidemiology Day for all of us. Can I share presentation? Oh.
Yes, please.
Yes, just, okay. Is it okay now?
Yes, perfect. Please put in presentation mode and go on.
Okay. So, thank you very much, Dr. Haytham. This is the presentation. I would like to focus on Iraq FETP and the sustainability plan for the Iraq FETP and how to build this system, this structure within the Ministry of Health to be more strengths and to how to provide the service during the last few years. So 15 years challenges and achievements during next few slides. When the problem becomes part of the solution, I think the right foundation for long sustainability. And here I am focusing on the COVID-19 because this is a good opportunity for the FETP to present the program for the Ministry of Health and to build the structures within the central level as well as at the peripheral level, that I said at the provincial and district levels. So the service providing through training, we are focusing on the service at that moment. On February 24th, 2020, the first case of COVID-19 was detected in Iraq, in Najaf, and the second case was the first case was detected, Dr. Abdulwahab, he's an FETP graduate, advanced FETP graduate. He participates in this mission. The second case in Kirkuk in 25 February, also the second case by Aliyah. She is an intermediate FETP graduate. At that time, all the resources was directed toward the hospitals, toward that, and PCR, ventilators, kits, and PPE, everything's. And the title of the training was removed from the Ministry of Finance. That is not any essential at that moment. So at that time, when we are starting to put the plan for the sustainability, how we can sustain this program. So the vision was changed that will be provide the service to the Ministry of Health and take the opportunity and take the problem that's mean the COVID-19 and how to deliver the service to the Ministry of Health as a part of the system. Like we do a lot of assessments, evaluation, we do the assessment for the isolation hospitals, for the surveillance, active surveillance, contact tracing, reporting, research, and everything. And during that time, all these activities was run and that under the direction of the mentors and the graduates, FETP graduates, and we include the trainees to be as a part of the team. After 1 year and or 14 months after detection of the first case of COVID, so the Ministry of Health, they're focusing on the FETP, and they found there is a necessary to build an administrative structures for the FETP within the Ministry of Health as well as at the provincial level. And in April 2021, they established the Epidemiology Department in the Ministry of Health as well as Epidemiology section in each province and the small unit, epidemiology unit in each primary healthcare districts. And after that time, we have about 100, more than 150 administrative units all over the country. And at this moment, there is no a large number of FETP graduates to cover all these units and sections all over the country. So we have to start to gathering more people and to train more people and to get opportunity, because we are during that challenge in COVID-19 pandemic. This is, as I said, this is opportunity for the training and to graduate a lot of people. And we are focusing on the front line as well as the intermediate, because there is short duration regarding or in comparison to the advanced FETP. And this is the structure of the FETP department at the Ministry of Health. So we have 3 main units. That's mean that administrative office unit and project management unit, consultation coordination unit, and the 3 main sections: field activity sections, applied epidemiology sections, and mass gathering sections. As I said, because there is no fund to provide it to the Ministry of Health regarding the training from the Ministry of Finance, there is no annual line budget. But we are notice that the surveillance and as well as the response is provided through the emergency fund. There is an emergency funds should be available all the time. So we include within this system the RRT as well as event-based surveillance. So during this circle between the surveillance, between the EBS and the RRT, rapid response team, during this circle, we include the FETP trainees working with the surveillance and working in the field and response. And during the circulation of this activities, we hope to sustain the FETP to to be more sustainable within the Ministry of Health, and there is a lot of fund providing to support these activities, as well as you know, there is a lot of mass gathering activities in Iraq, most probably in Karbala. So we also initiate and built the mass gathering sections to be as also an area for the training for the FETP, as well as it's provide service for the Ministry of Health. So new services added to enhance sustainability, event-based surveillance, as I said, and rapid response team, mass gathering, real-time surveillance. All these provided because there is an annual line budget to provide these activities. And later on, 1 year later on, we initiate the mass gathering as a public health program, and you get approval from the Minister of Health, and we assign an annual line budget according to the activities, and we now send a letter for the Ministry of Finance to get a final approval to be a separated line budget, because now we have an annual line budget for the FETP as well as for the mass gatherings. There is another line budget to be to cover all the activities for the services for the Ministry of Health. At the same time, it is support training. And next year, we are working to establish RRT as a public health program, also to assign an annual line budget for the RRT. If we look here for this diagram, this is a historical view for the establishment of the 3 tiers for the FETP. In 2010, they established all the advanced FETP. Until now, we have 10 cohorts graduate with 76 graduates, and the cohort 11 is now in the process for the training. Intermediate established in 2019, and now we graduates 4 cohorts, 180 graduates. The 5th cohort is within the process. Basic and or frontline in 217 established. 11 cohorts graduates, 260, and the cohort 12, 13, 14 in the process, with 54 trainees now under training now. In 2023, there's 2 cohorts graduate, 1 health FETP, 1 health frontline FETP, 42 graduates. And now we are in the process for the 3rd cohort, 1 health. Actually, now the last 3 cohorts, it start as a sub-national level, because till the first 10 cohorts of the FETP, it is under the at the central level. But now, after establish the new sections in the periphery, in the provinces, and we have a lot of mentors and facilitators, trainers. So we established gathering all about 3 to 4 provinces to gathering all the trainees and to create 1 cohort. And there will be, so we pushing the front line to the sub-national level, but under the supervision of the Ministry of Health, has been under the supervision of the central level.
Dr. Yasir, you
Yes.
are my friend, but I will not allow you extra time. So if you can go faster.
Sorry again, Doctor.
I said you are my friend, but I will not allow you extra time. If you can
Yes,
go faster
yes.
and wrap up in one.
Okay,
Yes.
okay. Thank you. So this is till the 2018. This is the number of distribution of the advanced and the frontline FETP. So there is more focusing on the central level. There is at the periphery of a lot of regions in the Iraq. There is no graduates of FETP, and after COVID-19, as I said, we are focusing on the services. We increase the number, and we're focusing on the periphery or the peripheral provinces, and we cover all the provinces all over the countries. This is in brief the last the last slide or the before the last, the establishment of the administrative unit, as I said, in the Ministry of Health department at the level of the Ministry of Health, as well as the provinces and units at the provincial level. FETP recognized by the Ministry of Health and Ministry of Finance as one of the public health program, and this is allocated an annual line budget for the central level, as well as there is each province there is an annual line budget as a provincial level. All employees in the FETP department sections unit are officially Ministry of Health staff, and FETP graduates are at its 3 levels. All this, they get the salaries from the Ministry of Health. All trainers, mentors, field supervisors are MOH employees, and almost all of them are FETP graduates. Nominate FETP graduates as a member of Ministry of Health Public Health Advisory Committee. This is the higher level committee in the Ministry of Health. Nominate FETP graduates as a member of the Scientific and Ethical Committee for Research. Official letter sent to the Mosul Basra universities in the northern and southern of the Iraq to expand the acceptance of the advanced FETP. Another letter for another college to join the intermediate with the university to provide a professional diploma. Advanced FETP training has been approved by the Arab Council of Medical Specialization. MOH provide additional space, additional rooms, and for the FETP department in response to increase the duties and personnel. And MOH has allocated budget for the training, renovation, furniture, accessories, computers, and everything for the FETP as a part of sustainability. Thank you very much. This is the last slide for the FETP. In the last November 2024, we get an accreditation for both advanced and intermediate tier. And as Dr. Haytham, he said, this is the first country and the first in definite history, first country get the accreditation for both tier at the same time. Thank you very much.
Thank you and congratulations. I think, again, another success story. An example of how a country can utilize the graduates of FETP to lead the health system, health departments, both at the center and the governorates, is Jordan. So my pleasure to invite Dr. Tariq Al-Damin to tell us more about Jordan FETP. Dr. Tariq?
Hello, good morning, good afternoon, good evening. Can you hear me?
Yes, we can.
Yes, I will start by sharing my screen. So again, good morning, good afternoon, good evening, wherever you are, and happy World Field Epidemiology Day. My name is Dr. Tariq Al-Damin. I'm presenting on behalf of Dr. Majid Asad, the head of community medicine and FETP director. Because of some health issue, we wish him a rapid, healthy recovery. So for the Jordanian Field Epidemiology Training Program, it's a regional global model for field epidemiology training program. It's a 2-year training program in applied epidemiology modeled for the Centers of Disease Control, the CDC, and Epidemic Intelligence Service. The mission of the Jordan FETP is to increase epidemiological capacity of national public health workforce. A brief history of the JFETP. It was established in 1998 with funding from the U.S. Agency for International Developments with Jordan Mission and with technical assistance from the CDC. Our first cohort graduated 6 total residents at the completion of the 2-year training. The JFETP was supported by a CDC assigned resident advisor from 1998 until 2007. Since 2007, the program has been fully supported and managed by the Jordanian MOH, the Ministry of Health, the technical support, of course, with thanks from EMPHNET. Today, the JFETP is housed within the Ministry of Health at the Primary Care Healthcare Administration in the Ministry of Health itself. So Today, the standard CDC FETP curriculum with modification and case studies based on the needs and assessment of Jordan's public health status is applied here. The residents are engaged in many levels of Ministry of Health during their residency, and after that, since they are integrated in the community medicine residency program, so in the FETP for the 2 years, they go to the communicable, non-communicable disease directorates, and from there into all the departments that are needed. The Jordan FETP has incorporated into the community medicine residency program as part of the Jordan Medical Council, Jordanian Board in Community Medicine. This is to ensure their sustainability and the strengthening of the program. The FETP now counts as 2 years toward the Community Medicine Board, which is by itself 4 years. So by 2024, the end of December, the program had graduated a total of 126 physicians with 20 residents currently in training. The residents who have enrolled in the program so far have been all physicians except for 2 veterinarians who enrolled during the height of the influenza epidemic in 2007. The role of the FETP in the Ministry of Health, we have divided into residents who are a source of the MOH throughout the residency period and have the capacity to conduct activities, address urgent needs such as an outbreak investigation in any of the governorates, conducting studies if needed, having any kind of national studies, as I will explain later. The graduates are highly qualified since they have finished their FETP and then later on their community medicine residency. They will be well-trained professionals. They bring high levels of skills at the MOH, at the central and the governorate levels. Talking of which, 124 physicians graduated and 20 in training. As I said before, 70% of the Jordan FETP graduates work at central or governorate levels. Pre the IHR requirement, there is 1 field epidemiologist per 200,000 of the people in the country, and 11 of the 12 governorates have at least 1 FETP graduate working at government level in health directorates and such. Current activities, in-depth training is provided in all aspects of field epidemiology. Technical support also is provided to each resident to conduct studies in area of priorities, evaluate programs, including surveillance of surveillance program, surveillance evaluation, and outbreak investigations. Most of the residents are active participants in current nationwide public health surveys and assessment of vaccination coverage. Most of them that will come soon, like the stepwise and the vaccination coverage, the national. Latest achievement, the last cohort graduated in December 2024. Team leaders and main members of 40 National Rapid Response Team, they are RTs. They assisted with major outbreak investigation, most recently gastroenteritis outbreak in Anjara in Ajlan Governorate in May of this year. It was investigated, promptly controlled by FETP graduates and residents as leaders and members of Rapid Response Team and resolved the cause and symptoms of the patients within 24 hours. I will talk about it later on the success story. And they also participated in local international public health workshops such as WHO's Public Health Intelligence and Mosaic projects. Here's a picture in Anjara's comprehensive healthcare centers from the latest outbreak investigation. And other than that, they attended launching of Jordan Adult Tobacco Survey, first of its kind, attended lung cancer awareness conferences, other local forums and conferences. They are, as I said, actively participated in multiple nationwide studies and surveys, such as the 25 Jordan Stepwise Survey for Non-Communicable Diseases, the 25 National Vaccination Coverage Evaluation, and in the same year, the National Assessment of Health Facilities. Lately, one abstract was accepted for... Yes?
So you have less than 1 minute.
Yes, less than 1 minute. I'll finish soon. One abstract was accepted for presentation at the 12th EMPHNET conference in Berlin, which was postponed, unfortunately. Other than that, 4 epidemiological papers are in the process of being published as case study developed by residents and graduates. For the sustainability plans, we are looking for facilitating, managing, and mentoring the current frontline and planning for 3 cohorts and frontline One Health program to increase capacities. Other pictures. For the challenges, we have consistent funding as fundamental issues, budget constraints, availability of project facilitators is limited as graduates assume responsibilities, and of course, mentors in the field who are behind the desk who need fostering in order to accommodate helping residents. Here's other pictures from the measles campaign from 2 years ago, and that's it. Thank you very much.
Thank you very much, Dr. Tariq. This is very interesting. And then, because of the time limit, we will go directly to our oldest program in the region, the Saudi FETP, and pleasure to have one of the public health leaders and eminent epidemiologists, not only in Saudi, but also in the region, Dr. Randa Noor, who is going to tell us more about Saudi FETP.
السلام عليكم.
السلام.
يعطيك العافية دكتور هيثم، وشكرا على المقدمة الجميلة دي. الله يعطيك العافية. Do you have the presentation or shall I share it mine?
It is ready for you.
Okay, thank you very much. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد أشرف الأنبياء والمرسلين. Today I will talk about the Saudi Field Epidemiology Training Program and alhamdulillah the 37 years of success that we are enjoying. Next please. Our Saudi FETP was established as the first field epidemiology training program in the Eastern Mediterranean region and remains the only FETP program in the Gulf region up to this day. It began in 1989 as a collaboration between the Saudi Ministry of Health and the US Center for Disease Control and Prevention and King Saud University, who is the certificate or the qualification accrediting body. Our FETP targets physicians and non-physicians, nurses, laboratorians, and other health professionals who have a primary degree in the health sciences. It also accepts trainees from some Gulf states such as Oman and the United Arab Emirates. Next, please. The main 2 training programs that are provided by the Saudi FETP are the Advanced FETP training and the Frontline FETP training. We also have participation in the Saudi Board in Preventive Medicine as a training center or accredited training center for the board. Next, please. We started with providing the diploma in field epidemiology since 1989, after which, after 2 years of training, the candidates are awarded a diploma degree in field epidemiology, which is equivalent to a master's degree. Up to this day, the Saudi FETP has graduated 35 batches with 210 trainees, and there is ongoing training for 2 further batches. Batch 36, which includes 12 trainees and who will graduate the end of this month, September 2025. Batch 37, who are 8 trainees and they are ongoing training at the 2nd level. And batch 38 will start training in October 2025. Next, please. Then the frontline FETP training, we started it later on than the advanced training. We have conducted 5 frontline training courses so far in different regions of the kingdom, each lasting about 3 months. Their aim is to increase awareness and skills of health personnel on the basics of epidemiology and surveillance. Next, please. As other CDC's field epidemiology training programs, the Saudi FETP applies a training approach that focuses on learning by doing. The trainees in the Saudi FETP at all levels develop competencies in several interrelated areas such as epidemiology, biostatistics, microcomputers, infectious and non-communicable disease epidemiology, scientific writing and report preparation, outbreak investigation, surveillance system, scientific presentation, in addition to other activities. Next, please. The Saudi FETP is an active member of relevant professional networks for training in field epidemiology. This includes the training programs in epidemiology and public health interventions network, the FETPnet at the global level. Currently, we are seeking accreditation by the FETPnet. Congratulations to the Egyptian FETP. And the Eastern Mediterranean Public Health Network, EMPHNET, at the regional level. Next, please. This graph demonstrates the number of Saudi FETP enrollees by batch starting from year 1988 till 2021. Next, please. This figure shows you the Saudi FETP training program graduates by gender. As you can see here, the females comprise a little under 23%. And the males a little over 77%. Next, please. By nationality, as I mentioned before, we accept trainees from other Gulf countries, but the major graduates are the Saudi graduates, comprising 90% of our graduates. Next, please. Now, alhamdulillah, there have been a lot of achievements by the Saudi FETP and a lot of success stories. I don't have enough time here, or يعني المجال لا يسع الصراحة إنه to mention all the achievements that have been gained by the Saudi FETP, and also the recommendations that came about by the Saudi FETP work. For example, we investigated numerous outbreaks of diseases such as COVID-19, Rift Valley fever, avian flu, MERS-CoV, in addition to numerous others. During the COVID-19 pandemic, there was full-time dedication by the staff and the trainees of the FETP, which contributed to a decreased response time from 48 hours to 8 hours, and the FETP led multiple COVID-19 investigations. Hajj studies is a very important achievements conducted by the Saudi FETP, and resulted in very important outputs, such as the establishment of food safety units in Hajj and the Hajj vaccines protocols, to name a few. Next, please. We have provided over 275 scientific manuscripts published in peer-reviewed scientific journals. The Saudi FETP research was presented in more than 400 international and more than 300 national conferences. The Saudi FETP received 9 international awards, including the Jon Snow Prize. We provide continuous strong surveillance support for the MOH, and produced over 80 surveillance reports to date. We have conducted systematic studies of nosocomial transmission of bloodborne pathogens such as Plasmodium falciparum, Klebsiella in the kingdom. These investigations were conducted in the 1990s, but have resulted in better infection control practices for preventing catheter-related infections and extrinsic contamination of infusates. Next, please. We published the Saudi Epidemiology Bulletin, which is a quarterly scientific publication that demonstrates the results of epidemiological studies conducted by the Saudi FETP. It has been in publication since 1993. It is registered officially at King Fahd National Library. It was published in paper form up till the late 2016, 2017. After that, it became an online journal. We also published the monthly epidemiological report for communicable diseases. To date, we have conducted 71 short training courses in different epidemiological topics, such as outbreak investigations, data analysis, basic epidemiology, in regions over the kingdom. We have also hosted 2 international epidemiology conferences in collaboration with the Saudi Epidemiology Association. Now its name is Saudi Epidemiology Society, and other partners such as the Saudi National Guard. Next, please. There have been many success stories and well-known accomplishments from the Saudi FETP graduates over the years, whether those who are of Saudi nationalities or those from the Gulf regions. The scope here does not allow a mentioning of all these accomplishments, but here are some examples to name a few. I can see actually from the attendees some of our FETP graduates, and I'm honored to have them with us. Next slide, please. Okay, Dr. Abdelaziz bin Saeed, he is a professor of preventive medicine and at King Saud University, and was the previous deputy of public health in the Saudi Ministry of Health, leading most MERS-CoV outbreak investigations at the time. Dr. Ali Zahrani at King Faisal Specialist Hospital and Research Center, Chief Epidemiological Scientist. Dr. Abdul Hafiz Turkestani, rahimahullah, he did a lot of work in Hajj. He was head of the health affairs for public health in Mecca, and provided a lot of guidance and hard work during many Hajj seasons. Next, please. Dr. Abdelaziz Al-Mishal, he's our current general supervisor, and he's worked hard to move our Saudi FETP to the Public Health Authority. Dr. Jabir Sharahili is the author of several public health books and previous program director for the Saudi board in preventive medicine, the Field FETP Training Center. Dr. Samin Modra is the director of public health information department at the Gulf CDC. Next, please. Dr.
Sure,
Abdullah.
Many stories to tell.
Yes, Alhamdulillah. I'm almost done, Dr. Haytham. Dr. Abdullah Judi, he's the chairman of the ethics committee in the Eastern Province, Imam Abdurrahman Faisal University. Dr. Abdul Karim Al Gouedi, he's a consultant in preventive medicine and currently the director for Saudi Board of Preventive Medicine in Al Hasa. Dr. Salam Abul Hassan, head of the extended program of immunization at the Saudi Ministry of Health. Next, please. Dr. Ali Al-Wadi, previous head of the smoking cessation program. Dr. Amin Mishkhas, previous director of the communicable disease program, and he worked very hard as the national coordinator for the polio and the MMR elimination programs in the Saudi Ministry of Health. Dr. Tomadur Kurdi, previous head of the food safety program at the Ministry of Health. She prepared the guidance manuals for food safety professionals. These are just a few examples of our many distinguished graduates. Our future outlook, it is hoped that the transfer of the Saudi FETP to the Saudi Public Health Authority will be a positive move that will further bolster FETP training to meet the priority public health conditions of the Saudi Arabia and fulfill the Saudi 2030 vision. Thank you very much.
Thank you, Dr. Aranda. I think you have one name missed from that list, your name.
Thank you, Dr.
You should add your name. So moving forward, and I think we are all looking forward to hearing from Dr. Muntasir from Sudan FETP and see how the Sudan FETP journey throughout its journey since the establishment, particularly during this hard time in our country, Sudan. Dr. Muntasir, the floor is yours.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much, Dr. Haytham, Dr. Muhannad, Prof. Yusuf, for giving Sudan this opportunity to be part of the FETP family since 2016. I would like to share some slides. Is it okay now?
Yes, we can see the slide, but if you can put it in the presentation mode, because yes.
طيب as I mentioned that the establishment of the system in Sudan started since FETP since 2016, but before there was progress to reach this. The first was the CDC team visited the country during 2011 to assess and evaluate the situation of the Sudan, and also put the possibility of giving the Sudan the opportunity to have having the FETP. Unfortunately, it was not a successful mission, still because of the restriction from the USA at that time. But that opened to us a door with EMPHNET, with Dr. Muhannad and his team. That gave us also an opportunity in 2013 to getting EMPHNET in a short course for the country surveillance and outbreak investigation and response. And from that, Dr. Muhannad started having a good collaboration with the country, and in 2016 that there was the agreement between the Federal Ministry of Health, Sudan, and EMPHNET to having the FETP, Sudan FETP. Before that, with the history, we thank Egypt because we have 3 graduates from Sudan, Federal Ministry of Health, by Egypt FETP at that time in 2008. 2 of them graduates by MD, and one of them was a certificate of 2 years certificate of FETP. So the country itself, as you know, that it is one of the biggest country in the continent, more than 1,800,000 kilometers. And the country itself witnessed, after the COVID pandemic, witnessed the war in 2023 that affect the health system itself. This impacted the people health, as I mentioned, and affected almost all in the country, the safe states and also the states with fighting. But one of the success that our graduates who were living still, and they are living still, they start to contribute from their sites at state level with the ministries of health. And this gave us the success of resilience system of the Sudan health, a resilient system to rebuild and come back after damage of most of the infrastructure at the central level of the country. And this also affected negatively, unfortunately, the provision of service, even the BHC, EBI, and also the surveillance system. So from the history, as I mentioned to you, since 2016, 5 graduates. We have 5 cohorts, 2 advanced and 3 intermediate, and all of them around 63 graduates, intermediate and also advanced. In addition to that, also jointly with EMPHNET, there are another basic trainings that targeted the EPI focal person at locality level had been conducted in 2007-4 and here during 2025-3. The program training played a pivotal role in advancing the country public health system by building skilled human resources. And as I mentioned, we have graduates that now they are taking the lead at the emergency directorate at their state level. We have also graduates from the system as advanced and intermediate at international and UN NGOs and international NGOs and UN agencies like WHO and UNICEF, country office here in Sudan. And we are proud also to also having the technical advisor at Qatar, one of the Sudanese graduate, intermediate graduate from the country here, Sudan, FETP. This is part of what is going on in the country, and we think through the war time and also even previous, the graduates played role in improvement of the reporting by texting and reporting also electronic, since this is one of the Federal Ministry of Health Emergencies and Epidemic Control aim to get electronic system, and we have now electronic data, that dashboard that shared with the relevant focal persons at the Emergency Operation Center at national level and also at the periphery level. They also participated as graduates in outbreak investigation and response to several diseases and events, including Mpox, also cholera, dengue fever, yellow fever, and further viral hemorrhagic fevers and vaccine preventable diseases, in addition to the rainy season 2020-2021 and also 2022. The heavy rainy season that also has been supported by technically by our colleague in EMPHNET. This is some of the activities that our colleagues, graduates, and also during their residence, they participate actively in most of the country events that happen during their time. Also in the researches, as you know, we have participants also, they publish, graduates, and also during their residence, they publish, and particularly for cholera, for assessment of surveillance, and for Mpox investigation and response. This is part of their work, and now even when they graduated, they started also to participate in the globally now with the EMPHNET and with other conferences. This is from my side. Thank you, Dr. Haitham.
Thank you, Dr. Muntasir, and congratulations on the achievement despite the challenges. I have been notified that Dr. Abdullah is with us online, although I cannot see him. So Dr. Abdullah is going to present on behalf of Yemen FETP. Yes, can you confirm your availability, Dr. Abdullah? Abdullah bin Ghus. Okay. Obviously, he dropped out. So I think through this journey, listening to the leaders and directors of the FETPs in the region, we have learned a lot about how those programs evolved over time and their significant contribution to their national health systems in various aspects, particularly in disease prevention, epidemiology, surveillance, outbreak investigations, and other areas. However, just to see the full picture, our team thought of bringing voices from the field, our younger colleagues, the graduates, to listen to their personal as well as professional journey of and success stories. So a pleasure to invite Dr. Muhammad Qasim from Afghanistan FETP to share with us his story in preferably, please, in 3 minutes or to give the opportunity for other speakers as well. Yes, Dr. Muhammad Qasim, please.
Thank you so much, sir. Do you have my screen?
Yes, you have your screen.
Bismillah ar-Rahman ar-Rahim. Dear colleagues, fellow FETP residents, graduates, mentors, and health professionals, first of all, let me take this moment and congratulate all of you on the World Field Epidemiology Day. The boots on the ground and the real deal of epidemiology. The unwavering commitment the field epidemiologists display is incomparable to any truly magnificent. While the magnitude of their impact is fascinating, we as field epidemiologists have the experience of trailing dusty roads, muddy areas, snowy days, and many more scenarios from dusk till dawn to meticulously investigate and address public health issues. Today, as the World Field Epidemiology is celebrated globally, I am privileged to share my story before you. In October 2023, I witnessed one of the most pressing public health challenges of my career. The East and South neighboring country of Afghanistan, Pakistan, which hosts Afghan refugees, began the expatriation process of Afghan refugees, forcing more than 500,000 people to return Afghan with short notice and in a span of few weeks. At Turkham border crossing, the busiest entry point, families poured into Afghanistan, exhausted, uncertain, and carrying few belongings. As a Field Epidemiology Training Program resident and class representative of the 5th Intermediate Cohort, I knew this mass return could create significant gaps in the routine immunization coverage. Unvaccinated children could become vulnerable to preventable disease, and place added strain on already fragile health system. The question for me was clear. How many of these children had missed vaccine and how could we help authorities plan better? With that sense of urgency, I proposed to Afghanistan Field Epidemiology Technical Team to conduct a survey aiming to understand the immunization landscape among returnee children, particularly under the age of 2, supported by the Afghanistan FETP Technical Team. I organized and led my peers to the Turkham 0 point right at the Afghanistan-Pakistan border. For more than a week, we stood shoulder to shoulder with families arriving in waves. I guided the team in sampling households, interviewing caregivers, and recording immunization histories. Each day presented challenges, logistical barriers, weather problems, missing records, and the sheer fatigue of parents who had just endured displacement. Still, I used the lesson I have learned from FETP program to communicate effectively with non-technical people, directed the team efficiently, and kept the spirit of the team high, as I knew what it takes to be a field epidemiologist. We used structured FETP tools to ensure the data was both significantly sound and actionable. I took responsibility for daily debriefs, troubleshooting logistical issues, and maintaining clear communication with supervisors. Our finding provided a snapshot of immunization coverage in a sample of more than 400 households, returnee children. We also identified factors influencing vaccine uptake, such as mobility, lack of documentation, and distance from health facilities. These insights were crucial for integrating returnee into Afghanistan's API. Wanting the results to reach beyond field notes, I compiled our data and submitted an abstract to a French medical institute for mothers and children, 14th scientific conference with help of Afghanistan FETP technical team. When my work was accepted for oral presentation, it felt like a validation of our team's effort at the border, standing before more than 100 health workers and national authorities. I shared how a small FETP-led initiative at Torham could influence national immunization planning. The reaction and reception of the finding was deeply rewarding. Many colleagues approached me afterward, eager to discuss how the finding could guide future interventions for mobile and vulnerable populations. This experience transformed me both professionally and personally. It taught me that being an epidemiologist is not about numbers and charts. It's about listening to people's stories, understanding their struggles, and translating data into decisions that save lives. I now serve as a surveillance officer for Kapisa province, where I continue to apply the lessons of FETP every day. The modules I studied gave me the skills to analyze data. The field work at Torham taught me the courage to lead under pressure. Most importantly, it showed me that when trained field epidemiologists act quickly, they can bridge the gap between a crisis and a solution. Dear colleagues, the path of becoming field epidemiologists is filled with challenges, obstacles, and risk, along with sleepless nights to understand the hard biostatistical concepts and completing the deliverables. But at the end of the road, a relief of the community from a particular health problem after your involvement as field epidemiologists, worth every second of the challenges and problems. As a concluding remark, I want to take this opportunity and express my deepest gratitude to Eastern Mediterranean Public Health Network in organizing this event to gather the field epidemiologists and celebrate this important date. Thank you once again. I am more than happy to answer questions, if any.
Thank you. Thank you, Dr. Muhammad. And next, we will be listening to Dr. Fablina Noshin from Bangladesh. Thank you. Dr. Noshin?
Yes, am I clearly audible?
Yes, you have 3 minutes.
Yes. Okay, so the presentation, do you all see this presentation? Can I start?
Yes, please. Yes.
Okay. Good afternoon, good morning, and good evening to everybody, dear colleagues. I am Noshin Fablina, a physician and also a field epidemiologist from Bangladesh, currently working in the Ministry of Health and Family Welfare, Bangladesh. Over the years, I have been involved in several outbreak investigations and disease surveillance activities in Bangladesh. Today, I will briefly share one of my recent work or activities in strengthening the malaria case monitoring in the remote hilly regions of my country. So, how the institutional transformation through data happened. In malaria surveillance, there were some challenges. In Bangladesh, you can clearly see there are 13 malaria-prone districts, and among them, 80% of the area were remote, hilly terrain, where the routine supervision and the data transfer was logistically difficult. There were no GPS coordinates of the case location, and that limits our scope for case monitoring. And also, because it's a remote and hilly area, there were limited or to no internet access that impeded the timely reporting of the data. So in that case, to address the challenge, I introduced a simple but effective solution, an offline GPS tracker integrated into a structured Google form. I trained 13 surveillance medical officers in the field, and even without the internet, the GPS is automatically stored into the case location. Later, when they synced their devices, the data was transferred to the surveillance system. This allowed us to collect real-time location-specific data directly from the malaria-prone remote areas, improving accuracy and reducing the reporting delays. With this GPS-enabled form, we had established tier-based case monitoring system. So you can see the data here. Firstly, we see the districts. There are 1,093 responses from the districts. These are the malaria-prone districts. And if we zoom in one district, that is Cox's Bazar, you can see the Upazila, the sub-district level. This is the district level, this is the sub-district level. And this is the lowest administrative level, the union level. So we have the tier-based data, and also more specifically, we have their specific geolocations. And along with this data, we also collected the type of malaria cases and the type of the species, and if the malaria were severe, did they receive the pre-referral treatment or not? And also we have a type of laboratory diagnosis performed. We had all kind of data. And along with that, we had timestamps to verify that the data was entered promptly and aligned with the field events. Together, this gave us a complete case picture linked directly to its geographic location. As Bangladesh is working toward malaria elimination by 2030, precision surveillance becomes an absolutely critical. To achieve elimination status, we must be able to provide a proof of 0 indigenous cases sustained for 3 consecutive years, ensure early detection and rapid containment of the new cases, and maintain real-time GPS-linked data for transparent verification. The GPS is enabled tier-based monitoring system, and I introduced directly support this goal. By combining location precision with the case details, we can implement micro-targeted interventions, directing resources, treatments, and vector control exactly where they are needed. So this is a scalable solution for a resource-limited setting where there is limited to no internet access. So our goal is simple: elimination of malaria in Bangladesh by 2030. Our solution is scalable, crafting context-driven solutions to strengthen the surveillance, and to looking ahead, equipping a low-resource settings with tools that can be attainable and influencing the system for global preparedness. Thank you.
Thank you. This is brilliant, and I think you presented something similar during the CDC, the international might, if I recall. Thank you, Dr. Fablina. And now moving on, and I would like to invite Dr. Zainab Abbas from Iraq FETP to share success story.
Thank you, Dr. Haytham. Good afternoon, good evening, good morning for my colleagues, and happy World Field Epidemiology Day. It's my pleasure to be here with you. Our success story today is about enhancing the early detection of epidemics and public health emergency in Iraq through event-based surveillance implementation. The event-based surveillance is defined as organized collection, monitoring, assessment, and interpretation of mainly structured, unstructured information regarding the health events or risk, which may be represented an acute risk to the human health. Information from the EBS can come from anywhere, including pharmacies, animal health sector, clinicians, school teachers, community members, and other key informatives. The problem we have is delay in detecting outbreak, as the traditional surveillance system rely on aggregated data and indicator, which may be delay in revealing the problem. So event-based surveillance, on the other hand, captured the early unofficial signal as well as unusual events such as sudden death, cluster of mysterious cases, which may not be detected by traditional system. The EBS also provide early warning, so the program help speed up decision-making and activate rapid response team. What we do, Epidemiology Department established the event-based surveillance in April 2024, which is considered one of the most advanced surveillance programs that provide timely reporting of the health-related events through an electronic platform. This rapid reporting enables swift response, creating a suitable environment for training. In doing so, we often a dual approach of service delivery and training. How we establish the system, there is an EBS unit within the structure of the department, as you show, if you remember in the presentation of Dr. Yasser. We have also high qualified FETP trained personnel at both central and peripheral level. The continuous training of medical and health personnel across various health institutions, including the primary health care centers, hospital epidemiology unit, and section in different provinces to ensure the system sustainability and success. The epidemiology section and units at peripheral level will be they are responsible for filtering, validation, classification, and analysis of the information. And finally, they provide a concerned department with the reports to take the action required. What's the challenges that we face? The staff member weak understanding of the concept of event-based surveillance, as most of their experience in the indicator-based surveillance. Weakness in the infrastructure in some area, difficulty in coordination between different agencies on multi-sector projects, and constant changing in the trained personnel. What we do to overcome these challenges? Continuous training and communication with direct supervisors to ensure that trained personnel are not replaced until coordination with our department to make sure that sufficient time to train the appropriate replacement. And also the Ministry of Health had committed to provide the necessary logistic support to implement this system by training the medical and health personnel across various health institutions. Then what we achieved, our achievement is about 1,502 health institutions implemented the EBS with 886 trained personnel in a period 10 months. This resulted in an increase in the speed of early detection, improve the flow of the epidemiological information, improve the reporting tools and procedures, develop analytic and response skills. For example, we have early detection of chlorine gas poisoning in Arbainia mass gathering in August 2025, and also early detection of food poisoning cases through EBS in some governorate. This lead to improve in the response. Here is the captures from the platform of the EBS. the event-based surveillance. This is the electronic dashboard called DHIS2. And this is, we make our mark. And thank you so much.
Thank you so much, Dr. Zainab. And,
thank you.
And just to share that I have witnessed your personal journey throughout your work with the Iraq FETP, and it's really impressive. So next, and without further ado, I would like to invite Dr. Shaima Buqamar from Egypt FETP. I think we have her with us. Yes, Shaima. Dr. Hala.
Yes, Dr. Haytham.
Do we
Dr.
have
Shaima,
Dr. Shaima?
Yes, she facing a problem for joining us now, and she will fix the problem shortly.
Okay. So then I would like to invite again Dr. Tariq Al-Dhamin to share with us his personal success story, as he shared with us Jordan FETP story earlier. As a penalty, you have only 2 minutes, Dr. Tariq, please.
Hello again. Is this my turn?
Yes, please.
Yes, okay. We'll start by sharing.
Yes, we can see your slides.
Okay. Hello again from Jordan. It's Dr. Tariq again. I'll be highlighting a success story about preparedness in action, about Jordan's rapid response to an outbreak in Anjar Ajlan. This outbreak happened in late April 29th, ended on the 10th of May 2025. The reason I picked this success story none other than others is because to highlight the cooperative response, the response from residents, the response from FETP residents, from graduates who are in the community medicine residents, from graduates and specialists from community medicine, from health directorates, directors, and departments, head of departments, and on governorate and on the central level in the ministry. So a little background, a brief one. The outbreak happened on 29th of April, ended on the 10th of May in Anjar Ajlan, governorate in the north of Jordan. The number of cases was 344. All of them were mild to moderate. They all came with gastrointestinal symptoms, presenting with diarrhea and vomiting within 10 days. They mainly all reported to Anjara comprehensive healthcare centers. So from this, the challenges became the identification of the source, because we have the food, the water sources. There are unregistered water springs, blue water tanks. Those are for irrigation and not for drinking. High public concern, of course, and risk of wider spread on social media, which would cause panic. So the response was from the ministry, from the governorate in Ajlan, that the source of the infection was identified within 24 hours of the first reported case. The response also happened by the rapid response teams, the RRTs, and led by trained FETP community medicine graduate and residents in communicable disease directorate from the Ministry of Health. Laboratory test confirmed the contamination, which happened in a number of spring waters and irrigation tankers, the blue tankers that I mentioned before. So the actions were taken of the closure of the unsafe water sources, provision of clean water households, disinfection of the contaminated household tanks, and of course, a public awareness campaign on safe water use. Here are some pictures which I chose to highlight because we have in the picture, we have FETP residents, we have FETP graduates who are still in the community medicine residents, we have community medicine and FETP graduates, we have head of departments, we have a head of directorate, and we have the health center level, the governorate levels, head of directorate, and we have at the ministry level, director of epidemics administration. So the outcomes, the outbreak was contained in less than 2 weeks. Daily cases dropped significantly later on, which holds the detail that it was a correct decision, correct actions, and of course, strengthened community trust through rapid source identifications. We have one of the quotes from Dr. Ayman Magable, who is an epidemics administration director in the Ministry of Health, which is within 24 hours, we identified the contaminated water source and acted. This rapid response was key to containing the outbreak. Closing remarks, which is that this highlights Jordan's FETPs, trained graduates, residents alike, along with the rapid response team, which proved that preparedness and quick action can transform outbreaks, which could cause panic, into a success story that protects communities and strengthens health security. Thank you very much.
Thank you so much, Dr. Tariq. And because of the letter Y, we will go now with a success story from Yemen, Dr. Khalid Saleh and Dr. Muhammad Ahmed Awad. If you have the also, I was trying to contact Dr. Abdullah, but he's not available. I don't know why. So please, Dr. Khalid, go ahead. You have 3 minutes.
Thank you, Dr. Haytham, and good evening for everyone. I want to express my sincere thanks to EMPHNET for the facilities and warm welcome and facilitating our visiting to Jordan during our visit, and all the facilities and assistance provided to us, which contribute to the success of our visit to Jordan. I have problem in showing my presentation on phone, but I can read from the laptop.
Or you can provide us with a summary in your own words. That would be more lovely. Yes, please.
Okay. As part of the resident exchange program between Yemen Field Epidemiology Training Program and Jordan Field Epidemiology Training Program, we visited Jordan to improve our skill in field epidemiology. And we have visited many various health institutions and take part in many activities. The objective of our visit to enhance knowledge and skill in field epidemiology and to learn best public health practice through visit to the health institution in Jordan, and to strengthen collaboration between FETP in Yemen and Jordan. We have acquired a skill as learning how to manage public health program in Jordan, and we have acquired a skill in disease prevention and control, and we have identified best practice in environment health. The activity conducted, we have participate in many activities, visit to Mafraq Health Directorate, and visit to the EMPHNET and known the action of the department in EMPHNET, and we have visited the Health Environmental Department in Amman, and we visited the Ministry of Health and meeting with the Director of Data Analysis and Disease Control and Disease Reporting. We have visited to the Malaria and Parasitic Disease Control Program and learned about the action of every department. And we have attendance in weekly meeting in Ministry of Health about immunology and epidemiology situation in Jordan. The last activity we have participated in presentation with residents in the field epidemiology in Jordan. The conclusion of our visit to Jordan, with the exchange program was valuable opportunity to enhance knowledge and expert in field epidemiology, and the exchange experience contribute to the development of our practical and analytical skills, and the exchange contribute to strengthen cooperation between the two countries, FETP and expert and skill of our in the field epidemiology. The last we have sensor tank and application to extend it to all exchange participants, trainer, organizer, and to EMPHNET for its support. Thank you.
Thank you. Thank you, Dr. Khalid, for sharing this reflection on the FETP exchange program. And I think finally we have Dr. Abdullah bin Ghot with us. So Dr. Abdullah, without slides, if you can briefly tell us about Yemen FETP in maybe 2 minutes. Please, Dr. Abdullah. Unmute your mic, please. Dr. Abdullah.
Yes, you hear me?
Yes.
I am sorry because I am present from the beginning of this webinar, but I received a lot of emails and a lot of link, and I confused what link I should use. Assalamu alaikum, congratulations for this all the Epidemiology Day. Actually, we are in Yemen. When we launched the FETP program in Aden, we get great support for the EMPHNET. At the beginning, we launched in 2022 two frontline workshop by complete support from the EMPHNET. Then we receive support, a fund from WHO World Bank in 2022 and conduct the third frontline workshop. Then in 2023, we launched intermediate courses. Now we are in the third batches, will be graduated at the end of this year, 2025. And in total, we conducted 5 frontline workshops with 115 graduated in these 3 years, and 2 intermediate courses with 31 graduates, and the third intermediate will be graduated in the end of this year. So the success of this program, because due to the exceptional situation in Yemen with fragmentation, political fragmentation, and fragmentation of 2 ministries of health in Sana'a and Aden, the program in Sana'a started in 2020 and 2009 or 2010, but the program in Aden started 2022. We get great support from His Excellency Minister of Public Health and the Vice Minister. Then they upgrade the FETP to National Public Institute by since November 2024, and this step I believe this is a great step, because the FETP is the leader of the National Public Institute. This is a good opportunity, and now we have a problem for the funding, because this year or the beginning of the next year, the call one of pandemic fund will be finished, and we take all our budget from the FETP till December this year. But we're looking for the call 3 if we success in multi-country with the EMPHNET, this call 3, we will benefit from them about training in FETP, especially in One Health training. This is one gap for us for One Health training, because now we have fund from the call 1 for One Health, but we till now not started to this training because there's some administrative problem for WHO. We hope EMPHNET will support to solve this problem, because EMPHNET is the delivery partner for the One Health training, and we lack the curriculum of One Health. This for this moment, but we look in future. Last week, in the last week, we opened the office of EMPHNET in Eden. We hope this office will support the epidemiological services in Yemen, especially FETP. And thank you.
Thank you, Dr. Abdullah. And just to reassure you, as well as for our countries, EMPHNET will always be here for you to provide its technical support. I'm sure that we have many stories, many reflections to share, and because of the time limit, unfortunately, we couldn't accommodate all those reflections. So my recommendation to Ms. Dana and Dr. Yusuf, maybe we can in the future to organize similar events or platforms to hear more from our graduates and residents about their success stories. And finally, I received a message from Dr. Anisaf. She's, as you know, the chairperson of the FETP Board of Directors. Because of another commitment, she couldn't join us this evening. Finally, I would like to sincerely thank each and every one of the extended FETP family in our countries, our headquarter team, and our partners. And let us work together to continue this journey, ensure the expansion, the excellence, and sustainability of our FETPs. Our journey is going on, inshallah, and we look for more. By this, I would like to thank you all. I would like to thank our audience and see you in future events. Happy World Epidemiology Day to all. Thank you.
Thank you. Thank you.
Thank you very much.
Thank you.
Thank you.
Bye-bye.
Thank you.
You're very much.
Bye.
Thank you.
Hello. Asana.